Hi, everyone, and welcome to Healthcare Policy and the Nursing Professional. My name is Debbie Sabota, and I hope by now you've viewed my welcome video to find out a bit more about me and my teaching style, and I hope that you've left me some information about yourself, your nursing career, and why you are obtaining your BSN degree. All of this information is valuable to me, and it helps me tailor the course a bit toward you as adult learners. This video right here is what I call my introductory video. I want to introduce the course contents to you a bit and find out what you know about policy and what you hope to learn. At the end of this presentation, I'm going to ask you to share with me what you hope to get from this course. In other words, what your one burning question might be about healthcare policy and how it involves you as the nursing professional. I am going to do weekly videos in the announcement sections. They're going to cover that week's objectives, discussion content, and any other helpful information that you might need for the assignments. It may also contain content from current events and current things that are going on in policy. This is a modern proverb. It says, if you don't have a seat at the table, you're probably on the menu. This kind of sums up why we need nurses to be involved in politics. If nurses aren't involved in healthcare policy making, then the policies are not going to be in the nurses and the patient's best interests. In this course, we're going to discuss a lot of things, but we're going to start off with nursing pioneers and their involvement in healthcare and policy. We're going to discuss advocacy and our role to change policies. We're going to consider healthcare problems and try to develop goals and plans of actions. We're going to read some healthcare policies in bills, and we're going to develop a healthcare policy or bill. We're going to explain the role of different special interest groups in nursing practice. We're going to describe policies that address patient experience and satisfaction. We're going to develop political competence and use that to interact with the legislator about a policy issue. We're going to talk a lot about the Affordable Care Act and its effect on consumers, and we're going to talk about fraud and abuse as it exists in healthcare. So what is healthcare policy? Why is it important to you as a nurse, as a professional, at the facility level, at the state, national, and global level? Healthcare policy refers to decisions, plans, and actions that are undertaken to achieve specific healthcare goals within a society. So an explicit healthcare policy can achieve several things. It defines a vision for the future, which in turn helps to establish targets and points of reference for the short and medium term. We have national healthcare policies, strategies, and plans, and these play an essential role in defining our country's visions and ensuring health for our population. Here are some examples of important policies, and this is just a small sampling. We have had healthcare promotion campaigns to prevent smoking and to initiate education to prevent smoking for teens and children. We have policies mandating child restraints and safety belts, disease prevention services such as immunizations, mental health care. We have policies that concern access to care for all of our community. We have policies that concern health information technology. There's been a lot in the media lately about breaches in confidentiality that either have to do with phishing scams or actual employee abuse of this technology. We have policies that concern reproductive and sexual health, gun violence, and the Affordable Care Act, Obamacare. Some healthcare policies and issues that defined this past year, artificial intelligence was one. If you haven't done much reading about it, I would encourage you to. It's fascinating as well as a little frightening. We have Medicare Advantage that's been in the news lately. Lots of talk about the opioid crisis and what the government could or should do. Of course, the cybersecurity breaches again. Lots of information about patient engagement and its importance, and it's linked to reimbursement, price transparency, and facility equipment, as well as drugs. Disaster preparation is huge. How can hospitals be prepared to handle things that have been happening in our communities? These massive gun violence incidences, floods, hurricanes, fires, tax reforms, and in particular how they work with the ACA repeal and replace, talk about entitlement reform and changes in Medicare and Medicaid, AIDS relief, value initiative that's going on in our hospitals, and value-based purchasing. And then, of course, we have our healthcare workforce programs, which concern our actual work environment, nursing, physician shortages, staffing ratios, was just big in Massachusetts at our last election. Workplace violence, regulatory standards, and hospital security. These are just some of the policies that concern us as nurses. So where can I find information about healthcare policy that's pertinent to me as a registered nurse? There's lots of information. We've got some readings that we've included in your Canvas assignments, but I'm going to take you now to the American Nurses Association website and show you around a little bit. So here we are. I've just Googled the American Nurses Association, and I'm at their website. The American Nurses Association is the organization that represents the interests of our nation's 4 million registered nurses. It's the forefront of improving the quality of care, healthcare for all, and advocating on healthcare issues that affect nurses and the public. As you can see up here, they are very instrumental in our ANCC credentialing. So if you have a specialty in nursing and have been credentialed, it could possibly be through the ANCC. And they also are responsible for all of our ANCC continuing education contact hours. So what I wanted to show you is right here where practice and policy are. And if I click on this, we can see here, healthcare policy. We can see some of the things that the American Nurses Association can be helpful for us in this course. There's a lot of information here about health system reform. You can click here and it'll take you into more in depth about the Patient Protection and Affordable Care Act. It talks a lot here about agencies and regulations. They get a lot of, they work closely, the ANA, with Medicare and Medicaid Services, or CMS, the CDC, the Federal Drug Administration, and Health Resources and Service Administration, or HRSA. And you can go here to find more about the oversight process for that. Care coordination, again, is another big concept in nursing these days. And you can click here to find out a little bit more about that. And then, of course, the health information technology. If we clicked on this, we could go and see a lot more information about that. So let's just look over here. And we can also click on advocacy, which was a big part of what we were going to be talking about in this course. So again, nurses' interest, state government affairs and federal government affairs. We can look at that here. We can see our states, our individual states' interests. We can look at political action committees, or PACs, that are important to nurses. If we go over here again, to this menu, we can click on Workforce. And again, this will open up information for us that is important to our nursing workforce. Our impending shortage, like I said, other opportunities for nursing, how it involves the Affordable Care Act and other reform initiatives, consequences for nursing shortages, and the like. So lots and lots of information on here. I ask you to take your time, come to this ANA website and just explore, and please use it for a resource for this course and in your, any part of your future nursing career. So here we are back at our initial presentation. And I have a question for you, as I told you. Think about it for a bit. I want you to tell me what you hope to get from this course. We've talked about a lot of information. What would you like to learn? Do you have like one burning question? This is going to help, again, for you as a student group and me to tailor the course and be sure that we cover the topics that you want to learn. I'd like you to answer this question using Screencast-O-Matic. Screencast-O-Matic is the tool that I'm using to deliver this presentation to you. And you can use Screencast-O-Matic to just deliver what is on your screen, like I'm doing right here. I showed you this PowerPoint that I developed, and then I brought you to that website, and I took you around the website a little bit. You can also use Screencast-O-Matic to just show yourself, your video, the video of yourself talking. And that's what I'd like you to do. I'm going to attempt to take you to a course to show you how to get into Screencast from the Canvas course. I am actually taking some courses to get a postmaster's certificate in online teaching or online education, and this is the Canvas site for one of my courses. So you're familiar with this. Here's the question, and here is where we would reply. If I click in reply, you're going to see these options up here. This is the Screencast-O-Matic option. Now, I'm not going to click on this because I tried to do that just a few minutes ago, and what it does is it interrupts the screencast that I'm making right now because it says that I'm already making a screencast. So again, you will click here and to begin to make your Screencast-O-Matic. So once you click on that Screencast-O-Matic icon, it's going to cue you to set up an account with your Canvas login if you haven't already done so. Then you're going to click on New Recording. You may have to download a recorder here if you don't already have one on your computer. Make your recording using the webcam choice. The webcam choice is going to show just your face. And if you're like me, you may have to go into the other room and change and perhaps comb your hair, because usually I am doing these kind of videos at home in my home office, usually in something like my jammies. Then make your recording, title it, upload it, embed it, and then save it. And that's it. Please, I don't want this to cause you any kind of stress. This is simply a fun activity to kind of get us engaged and let us get to know each other a little bit. So if you have any problems at all trying to do this, please let me know. I have given you my phone number. You can get a hold of me through Canvas email and through Baypath email, and we can set up a time to talk if need be. Okay? Thank you. Have fun with this, and I will see you online.